All right. Good morning, folks. Thanks so much for calling in today. We had a number of things to talk about, but I think we're going to cut straight to the biggest issue at hand, and that is the COVID-19 outbreak. Earlier today, we had yet another Senators Only briefing concerning the outbreak and where we are. I think it's really fair to say there was a bipartisan consensus that we are just not getting the answers from the administration about their response to this virus as we had hoped. And there's still a lot more questions than we're getting answers. First and foremost, I'm extremely concerned about the lack of availability of testing for this, both in Alabama and in the country at large. Until the tests are widely available and affordable, we're not going to really know the extent of what we're dealing with here. We need to be looking at the science and the best practices from around the world to determine what we need to implement in the United States. For example, South Korea is leading the way in drive-through testing for COVID-19. I hope that we can get private industry can continue to partner with the government to come up with some innovative solutions. Working with a bipartisan group of colleagues to expand the use of telehealth as our public health officials and healthcare providers continue to work on response to this virus. We got to do everything we can to prepare for and mitigate the impact of the coronavirus, and telehealth's a great way to do it. But in the meantime, we're continuing to monitor the situation and trying to do everything we can from a federal perspective, including getting the $8.3 billion in funding we passed last week out the door and into our communities. Now, because my top priority is the health and safety of the folks in Alabama and my staff, we have been exploring a lot of options to ensure that we're using the best practices in my office to prevent and mitigate the spread of COVID-19. We're going to be taking some temporary changes, making some changes in regard to the Washington, D.C. office, and you'll probably be hearing about that more in the very near future, if not today or tomorrow. Let me just say this. Alabama, thus far, at least at the last time I looked, had not seen a positive case. I did see yesterday there was one in Mississippi. That does not mean, however, that we don't have the coronavirus in Alabama. The odds are we probably do. It does not mean that we should panic. I've tried to say this for some time now. This is no reason to panic, but it is reason to be concerned. We need to take the steps now. Everyone should be taking steps to minimize the spread of this virus. Do those smart things. Don't think that for a second that this is going to be normal as life as we've seen it in the last few months. We're going to have to make a few changes. You're already seeing that with sporting events. You're seeing it beginning with some schools and other things. We're going to have to be smart. That's the bottom line. Let's be smart about this. Let's, on an individual and personal basis, let's do all the things that we can so that we make sure that we minimize the chances of getting the virus, or if we do, exposing others to that virus. Washing your hands, keeping your hands away from your mouth, trying to disinfect as much as you can, staying away from those large crowds. That's what we're going to be doing in our offices. That's what I've been doing this past week with all the meetings that we've been taking up here. If we do that, I think we can minimize this in the state of Alabama, and that's the real critical factor. Again, it's a real fine line here. We don't want to panic. We don't want to send everybody rushing. But at the same time, I don't want folks to be lulled into a false sense of security that this is not going to affect Alabama. It is going to affect Alabama. We know it. Let's just be prepared for it. So with that, I'm happy to try to answer any questions I can, although I didn't get a lot today. So I will do the best I can with what I know. Thank you.
Hey, Senator, it's Brian Lawson with WHMT.
Hey, Brian.
You mentioned the briefing this morning. Can you speak to the kinds of questions senators had where you didn't feel like you got good answers, and if there were any in particular that you had where you felt like you still need more information?
Yeah, I mean, it's very simple. When in the world are we going to get more testing? That was the dominant question, and it was the one thing that they could not tell us. The problem we've got now in the country is a lack of testing. We do not have test kits available. They're not sure when they will get more of them. Some states have more than others. And I think that's the biggest issue. And unfortunately, we did not get the answers. There have been concerns if you see there's a lot of restrictions on who can get tests. There's a lot of people in Alabama. Folks in Alabama have been calling our offices, not overwhelmingly, but we've been getting a number of calls of people that are concerned because they're trying to get tested and they can't, because the restrictions are such that unless you have, one, symptoms, and two, you've either had foreign travel or been in contact with someone known to have the virus, you're just not going to get tested because there are not enough tests available. That's the biggest issue that we're facing in this country right now, and it's the biggest unanswered question about when we will get those tests available, which is all the more important for people to just assume that the virus is around them and take the necessary precautions to try to mitigate getting the virus as well as spreading it.
Thank you.
Mr. Senator, this is Julia Smith from WVUA 23 News.
Hi.
Hi, I was just wondering if you knew what the $8.3 billion funding for communities would go towards.
It's a number of things, and we can get you the real specifics. There's a portion of it that is going to go to research and development to try to get vaccines. There's a portion of it that is going to go to try to help develop and get more testing out. That is the critical component. There's a portion of it that is also going to go to get more protective gear for first responders, healthcare officials, folks like that. There is a small piece of this that will be an economic impact, but I think right now the focus of that $8.3 billion is to try to mitigate and contain the virus, and that's trying to get money out into the communities. Again, the emphasis from our standpoint is really for testing with to try to test and getting tests available. A vaccine is going to be months and months away, and hopefully by the time we get a vaccine, this virus will have subsided. But we still want to get that vaccine out there as soon as we possibly can. But it's the testing and the protective gear for healthcare and first responders that I think are the most important right now.
Thank you.
Mm-hmm.
Hello, Senator. This is Stephante with WAFF. How are you?
I'm doing well. How are you?
I'm doing good. I have a question in regards to Medicare. Of course, we know that Alabama, they did not expand with Medicare, but how is the uninsured population impacted by this?
It's a great question, and I think what you're talking about is Medicaid, not Medicare. But yes, we have not expanded Medicaid, and it is a concern that the uninsured population of Alabama are going to be limited. They're not going to know what to do. There's a lot of things that we're looking at from a congressional standpoint that I hope we can get implemented. I mean, our concern and my concern are for people and not necessarily the stock market. We got a problem economically, and we're going to deal with that, but we've got to contain this virus first. And that means that if people are sick, they need to stay home, and they need to be able to be paid. They don't need to lose their money and their income because of this virus. So we're looking at issues to try to get that to them. The other issue is to try to get the testing out there so that anybody, regardless of whether they have health insurance or not, has the ability to get a test. Those are all in the works. Again, we're behind the curve. I mean, I'm just going to be candid about that. We're behind the curve. I don't believe the administration adequately prepared for this early on when they saw this coming, or should have seen this coming, and so we're trying to play catch up. But individuals, I still believe Medicaid expansion is not going to help with this particular situation today, but it certainly could help if we see anything similar again in the future. We need to have more people insured. We need to have more people that have access to health care than we've got in the state of Alabama. Medicaid expansion would allow another 300,000 Alabamians to have access to care and good health care. I really believe that we need to do that, and we need to use this as an example to help our folks in the future.
Thank you.
Mm-hmm.
Hey, Senator, it's Brian Lawson again. Just very quickly, are you hearing much from state actors here, whether it's hospitals or other folks kind of on the front lines of this asking for help? And if you are, what kind of help do they want?
Well, they won't test. I mean, I think that's the main thing. We have been in touch with state officials, and I think the state has got their task force, and they're doing all that they can with the tools that they've got right now. But we just don't have tests available. I don't know what the most recent numbers are, But as of a couple of days ago, Alabama had only tested about 20 people. I mean, that is, and I know there are a lot more people in the state that probably need to be tested, especially with, allergy season and flu season. I think the thing we're hearing most is, when are we going to get the test? I mean, that's the bottom line. When are we going to get the test? And you got to remember, so many people that may get infected with this virus are going to be fine. They're going to have symptoms, they're going to get sick, but they're going to be fine. What we've really got to do is we got to start making sure that we, number one, we do the social distancing so that we can protect ourselves and others. We need to protect the most vulnerable populations, which is going to be the elderly and those with pre-existing conditions. I learned today that facilities around Alabama, the senior care facilities have started to either minimize or prohibit visitors from coming in. That's going to be tough on our seniors. It's going to be tough on the facility where my mom is, but I think it's going to be necessary right now to protect that population. Those are the kind of things that we can do, and just understand this is going to be temporary. We will get through this. It's going to be temporary, but we just need to do, and we need to make the necessary sacrifices now so that we don't get into a worse situation down the road.
Sorry, just very quickly on the follow-up on that. We're seeing stuff out of Italy where their system is not able to meet sort of the demand of sick people.
Right.
I wonder if you're getting briefings on our capacity versus, if some of the numbers that are out there are correct. The potential likelihood of healthcare systems really being inundated with very sick people. Are you getting much projection done at this point, or is that still to be determined?
Unfortunately, Brian, everyone knows this is going to get worse, and that is about all they can say. They can't really give the projections because they really, again, and I know I sound like a broken record here, but they don't have the test and they don't have the capacity to make those projections. Italy did not do any travel restrictions. Italy didn't do a lot of things that they could have early on that we're finally starting to put into place now. And I think getting the word out. So I don't think that we will end up in a situation like Italy is, but obviously there is concern that the system can get overwhelmed. Our system and our healthcare system is based on a doctor-patient relationship. It's not based on something to be able to handle this. So we're having to adapt as we go forward. Hopefully, if we can get those tests out there, we're going to be able to plan and project a lot better. We just don't have that now. And I keep coming back to that. And I'm not trying to dodge your questions, but I keep coming back to right now, if you look at some of the other places in the world, the things they did to contain were more on a personal basis. They were really started to get people to do those kind of things necessary, to make those individual sacrifices right now to help the overall good. And I think that's where we are in the state, and I think it's where we are in the country that can help minimize this down the road. We just can't make those projections. Dr. Fauci was part of the briefing today and was asked that specifically. He just could tell you that it was going to go up. He couldn't tell you how quickly, how fast, or how high. That is the problem that we've got, and we'll know more if we can get more testing.
Thank you.
Senator, this is Mike Royer. How are you, sir?
Good, Mike.
Senator, I know you have a law degree and not a medical degree, but do you think my understanding is correct that we don't need to test everyone? If you're not aching, don't have a fever, if you feel fine, you would not be at the top of the priority list on testing. Those first tests that we see come into our state need to be used on people that suspect they may be ill. Do you think that's correct?
Yeah, no, I don't think there's any question about that, Mike. And remember, as more tests are available, we will be able to, I think, loosen those restrictions, for lack of a better term. I mean, right now in Alabama, again, we're getting into allergy season. People are sneezing, people are sniffing, people are coughing. Hit me a little bit this week. But I had no fever, and that's a real important thing, is a fever. And we've still got flu in Alabama. So I think the problem that we got is the restrictions will get loosened as we get more testing. But right now, if we do those kind of things to minimize the social interaction, and for those people who have symptoms that include fever, include respiratory issues, especially fever and shortness of breath, those are the folks that you need to get I think need to be calling their physician, calling the Department of Public Health, and to see where they can possibly get tested. They may be told right now that tests are not available and just stay home. That is an issue we're going to have to deal with. But for those folks who just got their seasonal allergies, don't worry about that just yet. Respiratory issues are the main driver right now. Fever and serious respiratory issues.
Thanks, Senator.
You got it, Mike.
We appreciate your time. You covered a lot of ground. Thank you, sir.
All right, thanks everybody.
Thanks, Senator.
We are in recess next week, but I want everybody to let me say this too. You guys are going to be really important in this, and I don't mean that just being solicitous here. You guys are going to be really important as we go forward in this to get out accurate information from the CDC, from the healthcare professionals, not just politicians. In fact, most of the politicians these days have been giving out inaccurate information. Referring back and giving folks the phone numbers to the Department of Public Health, to the CDC, let people start monitoring that. Trying to get this out and making sure people walk that fine line. We don't want to panic, but making sure folks understand that this is a cause for concern, but we can get through this. You guys are going to really be important as much as anybody else in this, as much as the doctors and the healthcare professionals. You guys are going to be important, not to put the burden on you, but it is going to be really important. So I appreciate the questions today. I appreciate y'all staying in touch. We will be doing things on our website and getting more releases out as they come. You can see some of the things that we'll be doing in the office. So I'll be in the state next week, and we'll probably try to do a few more things as time permits and as necessary. So thank you all for tuning in today. Thanks.
Thank you.
Thank you. Thank you.